Hello, everyone. It's December, time for our update for our December forums. So, of course, we're at the end of the year. 2025 is almost over, which is absolutely crazy to me. But we're getting close to Christmas. I hope everybody had an absolute wonderful Thanksgiving. It's one of my favorite holidays of the year. And, we absolutely want to wish everybody a Merry Christmas as we're coming up to a absolute wonderful time for us to be with family and remember why we celebrate Christmas to begin with, because our Lord and Savior actually was born in this month. So want to go over a number of things, and I'm pretty excited about these. But before I actually go into kind of the topics of the day, I wanted to let everybody know, we've had the issues where we just hadn't paid our taxes, hadn't filed them. A lot of that was a number of, probably reasons. I don't know all the details, but we just finished our 2022 taxes, got everything back from the auditors. Our 990 was filed this week. And so we are actually going to be meeting with the Gallup Sun for us to actually go over in detail and kind of share the details of the 990 for 2022. I'm also going to share kind of where our current performance is since we're wrapping up the year of 25. So we actually can kind of, be able to publicize kind of the progress that we've all made. There's been a humongous amount of effort this year. I'm very proud of everything that every one of the team members has done in order for us to get us here. It's really kind of honestly a miracle that we've been able to make so much progress in 12 months. It's highly unusual that this kind of progress happens this fast. I've been a part of many turnarounds, and they certainly did not turn around this quick. And I think it's really a testament to our team. So I want to thank everybody for that. As far as our topics for today, back to profitability, we're going to talk about our progress, and we continued every single month to make great progress. Then we're going to talk about our mock survey results and what that means, our operating update, our KPIs, the key performance indicators, right, that we talk about. And we've got them kind of in two areas. One, we're going to talk about the ones that were really have made huge progress. We've, consistently hitting our goals. And then we still have, a group of those that we actually still have, a fair amount of work for us to get to where we want it to be. We'll talk about the community update and then also successes, and then continue to have great progress with recruitment from a physician standpoint. And so we've had a lot of activity all year this year, and we've got some good news to share with that. So if you remember, I've been kind of, preaching this, if you will, for a number of months. One of the big indicators for us, or milestones, is for us to be able to actually have 100 days cash on hand. That's kind of that was that first level threshold that is going to help us from a creditor standpoint. You really bump our credit up as we're starting to rebuild that. With all the things that had happened in the past, we didn't pay our bills. We kind of destroyed our credit, right? And that happened over the last, 2 to 3 to 4 years. And so now we are obviously have no debt. We are paying our bills. And now we just hit 100 days cash on hand, which is a humongous threshold for us. So super, super, super exciting. If we think about our personal credit, what that means is if we have, if you have credit cards and you manage them and keep them paid off or keep them paid down, right? Those are positive things to your credit because it shows to the crediting agencies that you know how to manage your money. Well, it's the same thing with the hospital. If you can have at least 100 days cash on hand in order for you to get to that place and still pay your bills, you have to be managing your resources and being a good steward. And so we have been consistently doing that, and we've consistently been building that. That's our first threshold. We're going to continue to build that and get that, even higher. But this is a big milestone for us. So when we think about kind of the two areas that we've been really making the biggest impact from a savings standpoint, remember we were trying to hit that $500,000 a month and savings. We hit just about $230,000 on SWB. And then we had 171,000 in supplies that we did. And so we're just under that 400,000 range. So, we're doing such a great job of us really getting close to that target of 500,000. And so again, amazing, amazing work by everybody. Next, I want to talk about the mock survey, and I'll give you a little background first before we just kind of dive right into it. So when we think about all hospitals, they have to have an accrediting body that actually accredits them and then says, hey, you're doing all the right things, following the right rules, etc. And those are approved by CMS, which of course is a federal agency. There's Joint Commission, there's DNV, there's CIHQ. We happen to use CIHQ as our certifying body that says, hey, we are doing the right things, and therefore we have the ability to be able to get paid from Medicare and Medicaid. If any hospital was to lose their accreditation, then they would prevent themselves from being able to get reimbursed. So they would have those patients come into their organization and they wouldn't be able to get paid. And it would be the same thing for us if we were to lose our accreditation. So our survey is coming up in June. We want to be really ready for it. We've had a lot of change, right, in the organization. So we asked our partners in Ovation for them to bring some experts in to actually do a mock survey. And so they ran the survey just like it's going to be run in June. And we had a fair amount of opportunities. And so one thing that I think is exciting, we really kind of want to know, right? When we think about ourselves, we're a safety culture and how we're continuing to build on that. And then also thinking about a learning organization, how we want to learn from our mistakes and how complementary those two things are. This is really in the same vein of that. And so we need to know where we've got opportunities, where we need to change some things, where maybe we have a process that we're not fully following so that we can actually fix that, right? And we have to work together in order for us to continue to raise the bar on our organization. And so we had some opportunities that they found. And so what y'all will be seeing, definitely this month and throughout next year until June, is that we've taken all those opportunities. We're doing, action plans tied in with that. And then there's going to be education, rolling those things out to all of our departments where it's appropriate. And then the next thing in January, which is really when we want to start having our first audits, we want to start auditing. So if we put something in place, we changed a process or we re-educated on a process, we want to make sure all of us are following that so that it becomes a new habit, right? Every one of us, right? If you have old habits, I always say old habits are hard to break. And it's true. It is very difficult for us sometimes to break habits because that's where we're comfortable. That's kind of where we want to be. And so as we bridge and bring in new habits that we need to be doing because it's in the best interest of the organization, the community, and our patients, we have to make sure that those habits stick. And by us auditing and being able to coach each other and make sure that we're following those new processes, that is going to how we're going to develop those new habits. So that'll happen all the way through until June. And when June comes, we're going to be so ready for CIHQ. We're going to be able to blow right through it. It'll be a great celebration for us in July when we actually smoke the survey. So super excited about that. And I feel completely comfortable that we're going to do a really, really good job. On the operationals front, as most of us, unfortunately get to experience at times, we have some really old sewer pipes, big cast iron pipes. Some of them are 50 or 60 years old. And periodically we end up having leaks. It's a huge burden on our facilities team because they're constantly trying to, patch and piecemeal these things to keep them sealed up. It needs to be replaced. So in our collaboration with the county, we are actually going to work this next year in 26 in partnership with them for us to replace all of that old cast iron sewer line. It's going to have to be done in phases. because obviously we have to keep the hospital up and running. But that's going to be about a $3 million investment in order for us to replace all those sewer lines. I know it's crazy to think that it costs that much for a metal pipe, but it is what it is, right? The other thing that's kind of, it's not something we're all going to see, but it's definitely something we're going to enjoy when we are not having any more of those leaks or the smells sometimes that we get when we have cracks and some of that sewer gas gets released. And then we have those smells in different parts of the organization. So it'll be probably through the whole year. We'll be phasing that. We'll start with third floor first, and then we'll kind of work our way down. But by the end of 26, we should have all of that replaced. And so I'm going to consider that a really big win for us. Second thing around some of the KPIs, and I kind of want to dig into kind of our swing bed program. So as we look at, critical access and swing bed, when we shifted over into both of those, and it was probably March of 24 roughly. So it's been probably, it's 18, 19 months ago. What should have really happened, honestly, is that we should have, when we're on critical access or we are a critical access hospital, we have the ability to bill differently than we did as an acute care hospital. And so it's called Method 2 billing. In order for Method 2 billing to actually work, it has to be built in Cerner, which is our EHR, electronic health record. And all that stuff really should have been done before we actually turned into a critical access hospital. It should have been built behind the scenes, but it wasn't. So we're in the process. It's built now. We're still having some issues that the revenue cycle team, as we work through some of the bugs in order for us to get that, but it's going to have a positive impact for us from a financial standpoint. The second thing is related to swing beds. And so when swing beds, actually become established in a critical access hospital and you register yourself to be able to have a swing bed program, part of that follow-up that needs to take place is the insurance companies need to have your swing bed program registered with them so that they will recognize the program and then they will pay you according to the appropriate rates that should be come along with having a swing bed admission. We did not have that done. And so we have been working behind the scenes for the last few months in order for us to actually get registered with all the payers. We have 5 of the 7, so that's exciting. But one of the reasons why we've had a lower swing bed census, especially when we look at referrals from other places, has been because we have not been able to get paid because we were registered with the payers. And so we've actually had to kind of postpone admissions until we were registered with them. And so now that's opening back up. And so you will see the swing bed admissions rise. When we think about what the community need is and probably where we're going to land on average, we're going to have about 4 patients on any given day is probably where we're going to be. We also had a few needs on admissions. One was having the ability with swing beds to be able to do dialysis. We had to change our acute contract in order for us to have the ability to do that. And then also we had some need related to, some patients that had some pretty significant wound care needs. And so we needed to get a wound care specialist. And so now we have a nurse practitioner that's going through the payer enrollment process. And so we'll be able to utilize that for the clinical team. And so great excitement for that. We know that program is well needed in our community, and we're actually going to be able to do an excellent job with all the right resources as we kind of move forward. On the community update, if everybody remembers, we had the government shutdown, right, for over 2 months. One of the kind of negative things to that was our community was going to have an impact for people that had SNAP benefits. And those SNAP benefits, since we were down for so long from a government standpoint, the cards weren't going to be refilled. That was happening the 1st of November. So just like I think represents our normal culture here as an organization, what did the hospital do? We stepped up to the plate. We ended up, developing, meals that were kind of complete meals in a bag for all children that wanted to come. And we did that the whole month of November, gave out a lot of meals to families with their kids to make sure the kids did not go without food. And so that was exciting. Once the SNAP cards got refilled towards the end of November, we still kept it open about another week, and then it kind of dwindled down to almost nothing. The other thing was we had a big food drive that really completed itself by the 20th, so it was right before Thanksgiving. We were able to actually take to a lot of women's battered shelter, a number of places around the community that we were able to deliver a significant amount of food to those locations. And so I know that was a huge blessing to those areas. The last thing really was when we think about recruitment, we're trying to expand and get kind of a wider reach on areas that we think around the state that are going to bring some value to us as far as our ability to recruit the right kind of talent to come and work in our area. And so we went to Carrington College up in Albuquerque, and we actually were able to recruit a person from that open house. On the 25th of October, we had a trunk or treat, and oh my goodness, that was a ton of fun. Huge amount of fun. We're going to do it again this next year. We're going to probably have some themes and competitions, etc. And then we're also going to probably make sure that we're on an off weekend from when most of the churches are doing it. So we kind of give an opportunity for more kids to come and kind of be blessed by all the candy that we're going to give them. Last thing, other than recruitment, is really our successes to date. And so when I think about some of the ones that we've done really, really well, AR days, our accounts receivable, we started out about 70 days, and now we're down to 37. Kind of best in class is 45 or less. So we're doing exceptionally well. And if you remember, the longer it takes, the more AR days we have, the longer it takes for us to submit a bill out to the payer, right? And so we want to make sure that we can get that cash back in the door for the care that we've delivered. And so 37 is a really good time frame. Our OR team with on-time starts with the first cases of the day, because that sets the cadence of the day. You know, we've had a couple of months where we have just been kicking it out of the park in that space. When I look at some of our opportunities, you know, a lot of that is charge lag, documentation, charts being completed, etc. And so we're really working with both our hospitalist group as well as our ER group for us to get those charts completed. We'd love to have them completed same day, but we want them in a very short time frame so that when we look at our HIM team, that they have the ability to look at a completed chart so they can code that, and then we can get that bill out the door. The other thing when we look at some of the opportunities of where we've had some denials has been us not having the right insurance card. And some of that has been because of the lack of sophistication with our current system. It does check for eligibility, but it only checks one software database. We're getting Phreesia, which is going to be quite an up step from what we currently have. When we actually, you know, the admitting professional actually takes, you know, your card in and they put that in the system, it's going to run all the databases. And so what happens sometimes, I know I've done it myself, I get a new card, I forget to switch it out, and I'm taking in my old card. And what that means to us on the revenue cycle side is if we go and submit that bill, we're not going to have a card that's active. And so we're going to get a denial. And so that bill will come back to us unpaid. By us matching those things up with Phreesia, it's going to allow us to have the right bill with the right payer connected to the right patient go out the first time. And that's going to prevent a significant amount of denials, which also really rolls back into, you know, cash in the door for us to be able to manage our expenses right in a much more timely fashion. Last thing I'll go over is related to our physician recruitment. Super exciting news. Dr. Shaw is our cardiologist that's going to be coming on full time. He's going to start February 1st. We have not had a full-time in-house cardiologist, you know, for probably a decade. that is going to be a massive impact for us from a positive standpoint and our ability to take care of more patients that we did not have the right specialist resource to. The second thing to that is he's 2 weeks on, 2 weeks off. We're hiring a second one. We actually have an interview this Friday with another physician that wants to be full-time. So once we have both of those on board, we'll have, on-site full-time coverage. But starting in February, when Dr. Shaw is gone, we will have telecardiology that will support the other 2 weeks. So starting in February, we're going to have full-time cardiology support. It just, all of it won't be kind of physically in-house, but super, super excited about that. That's going to be a big benefit for both the clinic, the ED, as well as our inpatients. Last thing is going to be Dr. Warner. He is an orthopedic physician that is practicing out of Albuquerque and has been there for a number of years, and he is going to be starting at the beginning of next year. The exciting thing for us, he's going to end up probably being a week a month. We're recruiting at least 2 more orthopedic surgeons for us to kind of round out that. But I'm excited about us having, more coverage so we really can start to build our total joint program and probably in a better and bigger way than we have in the past. So that is everything for the update. I hope you enjoy your holiday and you have an absolute blessed rest of this year. And I will talk to you soon in the new year in 2026.